an experimental therapy that taught chronic spinal pain patients about neurophysiology and targeted movement may be superior to usual care at reducing pain and improving function. Researchers in a multi-center, randomized clinical trial in Belgium reported combining pain neuroscience education with movements that patients feared or avoided. The treatment produced better outcomes than current best evidence physiotherapy and yielded a 50% improvement in chronic back and neck pain, according to Annelien Melfeliet, MSc, Vrije Universiteit Brussels and colleagues. Improvements in pain and functioning were sustained for 1 year and were, likely the result of integrating the newly derived pain neuroscience understanding in specific fearful movements and activities, enabling patients to deal with pain in daily life, they wrote online in JAMA Neurology. Based on earlier studies, the researchers also expected to find changes in gray matter morphologic features, but none were seen, because of the clinically significant changes in this trial, that is, the reduction of pain and disability. In the absence of gray matter changes, we believe that to effectively treat patients with chronic neck or low back pain, these gray matter changes might not be as relevant as we thought before, Melfeliet told MedPage Today, in noting that hers was the first study to look for them in the context of physical therapy. Recent research suggests that people with non-specific chronic spinal pain may have hyperexcitable central nervous systems with altered nociceptive processing and gray matter changes that trend toward decreased gray matter volume. These changes appear to be in modulatory, emotional affective, and sensory discriminative pain processing regions and may be reversible. In this triple-blinded trial, researchers studied 120 patients with chronic non-specific spinal pain in 2 outpatient hospitals in Belgium from 2014 to 2017, randomizing participants to an experimental or control intervention. Both interventions lasted 12 weeks and included 3 educational sessions and 15 one-on-one exercise sessions with a therapist. The experimental intervention combined pain education with an exercise program that introduced patients gradually to movements they feared or that caused them pain. The education specifically focused on the neurophysiology of pain, explaining to the patient that pain is an output product of the brain, rather than a sign of tissue damage, Melfeliet explained. The treatment aimed to help patients move functionally and avoid what Melfeliet called safety behavior. When a patient experienced pain, the exercise was finished as agreed upon between patient and therapist.